the most important findings from ASCEND were that adding an aspirin a day to the treatment of people with diabetes who didn't have vascular disease when they entered the study did not provide overall benefit. So although there was a reduction in the risk of vascular events, so that's the composite of non-fatal MI, non-fatal presumed ischemic stroke or TIA and vascular death, that was reduced by about 12%, but we also saw a significant 29% increase in major bleeding. I think one of the messages from the study is that if you've got diabetes, we know that these treatments like statins, blood pressure lowering, not smoking, good glucose control are all important, and those are all safe interventions. Aspirin clearly works in terms of reducing risk, but at a cost of an increased bleeding, and we couldn't find a group within the study where the benefits clearly outweighed the risks.
I take it that we learned now in lower risk patients, either with or without diabetes, that aspirin works. In ARRIVE, it's if you take it, but in the diabetic population study, very nice benefit that's there. But it's equally balanced by bleeding, and so this means one has to have a discussion, and you don't just take aspirin because it's good for your heart, that you have to really think through and be aware that bleeding can be an issue. But I think very encouraging data that this does help prevent thrombotic events and can fit for some patients.